York, which is the epicenter of the COVID-19 coronavirus in the United States. Before we talk about what happened in the Senate, just another update of what the situation is in New York State, and the U.S. in general.
Yeah, this is, as you correctly point out, Peter, the epicenter of the outbreak in the United States. Of the 44,000 cases of COVID-19 confirmed here, 25,000 cases, so more than 50% of the cases are in New York State, and 15,000 of those are in New York City. So this is the city that is being hardest hit. You hear the most vociferous language from the leadership of the city, from the leadership of the state, in terms of the lack of access to protective gear that is still in short supply around the country. And you also see now an effort between the federal government and local authorities to expand, very critically, Peter, hospital capacity. Governor Andrew Cuomo has issued a demand to all hospitals in New York State to increase their bed capacity by at least 50%, but up to 100% if they can. They've also commandeered a convention center in Manhattan, one of 4 sites in the region, that will be rebuilt and earmarked for temporary hospital facilities. The Javits Center, Convention Center here in Manhattan, will have the capacity of 1,000 beds when the Army Corps of Engineers is completed with construction in about 10 days' time. So they're expecting a huge surge here. The governor has said a wave of cases is going to sweep over the healthcare system in this state, and they are trying to get as ready as possible for when that uptick happens. They say anything from between 10 days and 3 weeks. So we have a wave coming here. We're all waiting for it to hit.
All right, you talk about this wave coming, but you wouldn't think so hearing President Trump speaking. He was talking about easing restrictions.
This is the frustration, I think, facing citizens in the United States and leadership in their different capacities, from the local level to the federal level. They're not articulating the same message. They're not on the same page. And we heard that from President Trump talking about timelines, when timelines essentially are not clear. We've just seen South Africa institute a 21-day lockdown. That is an estimate. You see India doing the same, and you're seeing countries and states around this country taking different decisions. There's no uniform remedy to, you have a hotspot in New York, but there might not be as big of a situation in Idaho in the United States or in Indiana. So different responses, that are necessary for the situation at hand. But the frustration here is that the president, I think, is feeling pressure about the U.S. economy essentially coming to a standstill. We talk about this $2 trillion bill that Congress is currently negotiating in order to kind of buffer the impact of the economic hit that people are feeling now. But the difficulty here is that there is no uniform message. And in addition to that, Peter, state governments are in control of what will happen in their state economies. The federal government can say, let's open it up. But if you've got a spike in cases in New York City or in New York State, the mayor of New York and the governor of New York will take a decision as to when it is viable for that economy to hit the track again. So it's all just a lot of political bluster in a sense. The president does not have the authority to open up the economy in New York if New York, for example, is expecting a wave of cases to hit in 10 days.
All right, so you mentioned the word politics, and when we spoke about this yesterday, you said that perhaps we shouldn't overread what's happening in the Senate, but it's starting to feel and look like a lot of politics is at play in trying to pass this bill through that should bring some relief, not just to American corporations, but also workers.
I bristle at the notion of sounding like President Trump, Peter, but I was right yesterday and I'm right today. The Senate Majority Leader, Mitch McConnell, a short time ago, took to the Senate floor to say they're basically at the 5-yard line, a football term to say we're about to have a touchdown. This bill is going to be passed. Democrats, as I said yesterday, had their concerns, worker protections versus business interests that the Republicans tend to favor. They've reached some compromises. We understand Nancy Pelosi as well is seeking to introduce billions of dollars into this bill in order for states to, for example, conduct elections by mail. That could be an issue come November if this coronavirus case or the cases around the country, or the curve has not been leveled. So it was a negotiation. They are now closer. They've continued to work. Some of those procedural votes that failed, Democrats were saying this was sort of political stunt-making. Republicans are arguing that the urgency of the situation in the country demanded it. But what I can tell you now is that I expect today for there to be some sort of passage from the Senate. Of course, it then goes to the House. The House will probably want to reconcile a few issues there before it goes to the president for signature. But I believe that we will have a bill by the end of this week.
All right. So talking about this curve and this spread there, New York State, New York, the epicenter, and differences in the states across the country and how the situation is playing out. Is there a fear that it will also increase in other states? I know that I think at least 16 states certainly from tomorrow, Wednesday, will be under lockdown. Might we see more?
Peter, this is an unseen, unknown virus, right? There's no vaccine for it. We don't, there's no silver bullet here. You cannot see this virus. A lot of people are walking around with this virus and not showing symptoms, so they think they're very healthy. They then talk to someone, or, their spit droplets float in the air. Someone else gets infected, and they then begin to show symptoms and get severely ill. What we don't know is the extent to which testing is taking place across the United States. Different states have different capacities, different state laboratories that are able to conduct these tests. But if you are not treating this issue like South Korea treated this issue, where they had 50 drive-in testing areas where through a 10-minute process where you wouldn't have to even get out of your car, they would sort of put a swab through the car window, and this is how they would be able to diagnose people. If you do not have a great sense, Peter, of how many coronavirus positive cases you have in this country, then you don't know how severe this outbreak is going to be. So testing is still key. Test as much as you can, as many people as you can. What South Korea did, they moved from 909 daily new cases to just 64 new cases on Sunday. How did they bring down the curve? By testing and quarantining people that test positive. What we've done here is we've quarantined everybody, right? There are 110 million people quarantined in the United States. Many of those people are probably healthy. So we need to understand who is sick, who is infected.
All right, it looks like we've lost Sherwin there. On the line to New York, giving us an update, particularly where he is, which is New York City. And that, of course, has become the city that's the epicenter of